We're at Maui Derm for Dermtube meeting coverage. And I spoke about the use of fillers in many different areas, including the temple and some of the practices that we do, from considerations with a superficial injection and some of the vessels in the area to considerations with a deep injection on bone, and really the importance of having a light touch in that area. In terms of perioral use of fillers, we can inject the lip for lip volume, but really you have to look at the lip and see what other things are going on, because many people don't necessarily want volume. They want to actually approach some of the etched lines that they have. So if the etched lines are not numerous and there's a few lines and they're bigger than the tip of a needle, then I think putting a filler into those lines with little serial puncture can be really helpful. Sometimes patients do have some bruising for a few days, and I tend to use a pulse dye laser for that a couple days later at 7.5 joules, 6 milliseconds with a 10 millimeter spot. And then sometimes if patients have a lot of etched lines, I'll use a neuromodulator a week or two before resurfacing, and I'll use heavy full field erbium resurfacing so I can really recognize the pinpoint bleeding. If you're using filler in that area as well, studies have actually shown that you're not getting down to the level of the filler when you're placing filler more dermally or in the high sub-Q. So that's something that when we rejuvenate the perioral area, a lot of times we're using fillers in the nasolabial fold, into the marionette area, as well as some of the secondary smile lines, the mental crease, areas that we're resurfacing, but we're placing the filler deeper than that. And then when we're using fillers for hand augmentation, we can use a distal to proximal approach, or we can do a proximal to distal approach. The important thing is to think about what lies beneath, and I no longer pinch the skin when I'm injecting this area. I leave the skin in place because that dorsal superficial lamina is a very, very thin layer, and we really want to place that filler in a very superficial nature and then massage and make sure that we don't leave any lumps or bumps. I'll have patients make a fist with their hands so I can actually massage that area out. And there's two fillers that are FDA cleared at this point for hand augmentation. One of them is Radiesse and the other is Restylane Lift. So I think that really covers a lot of what was discussed at Maui Derm, and it's great to have you with us for Dermtube meeting coverage.